Hello, everybody, and welcome to one of our latest chats that we're doing with DMD Pathfinders and John. Whilst this coronavirus situation is still developing, John, how are you doing?
Yeah, good, thank you. It's I don't know. I've even lost count of the weeks. I don't know what week we're in,
Yeah,
but it's I don't know. I think I'm mentally starting to get used to this a little bit more. Um, Maybe it's just that I can't manage to keep this level of stress up. And I've just got a bit crazy. I don't know, but it's I feel a little better in terms of kind of a bit more settled into the routine a bit now, I think. How about you?
yeah, not too bad, not too bad. It's a crazy situation, isn't it? And I was about to say, you've been in the news a bit over this last week, but should we introduce and bring in Sarah
Indeed.
Rose first, and then maybe have a little chat about that? Sarah, lovely to have you on.
Nice to be here.
Yeah, thanks for joining us.
Do you wanna introduce yourself a little?
Yeah, I'm Sarah. I have Ulrich, CMD, and like John, I'm sort of just getting my head around it all. I think like everybody, I've had up days and down days, but yeah, it does seem to be settling, and routines are more established now because they've had to change quite dramatically. So yeah, just sort of getting used to it a bit now.
Yeah, and so John, it's been a busy last week for you, hasn't it?
Yeah, it has. Yeah, so I was on BBC News on last week. It just had a lot of kind of responses to that and a lot of feedback from that. I mean, um, sure, it's nice to be featured on the news and have your message listened to, but it's uh, I wish it was a better message, and I wish it was in better circumstances. So, my concerns that I was raising was around guidance from the British Medical Association in regards to how treatments would be prioritized for those with COVID-19, and basically just reacting to the idea that people in my kind of situation with living on long-term ventilation with quite an advanced stage of muscular dystrophy, then the idea that we wouldn't get access to the treatment because we wouldn't benefit quickly enough, that was quite concerning to me.
Yeah, have we got any progress on that? It was such a concerning state of affairs.
I mean, not as much progress as I would like to see, certainly. I think a lot of kind of groups and individuals kind of joined in, and they were concerned that people would be written off just for having a certain condition or having a disability and not being valued for that, which is certainly a concern, but I think that has been that part of it has been addressed, and I don't think that's something that people need to worry about. But I do think that there remains a big concern for people that actually have health difficulties and who are in not perfect health. And I think there is a risk that just because you won't benefit quickly enough, then you won't have access to critical care. And I think that's the key thing for me, because it's not about only treating those people that will benefit. It's about benefiting quickly. So, I might get the virus and I might take 3 weeks to recover. And they're saying that in times of scarcity, we need to be focusing on the people that might only take 1 week to recover rather than 3 weeks. And I just think that being in that situation, I just think that's fundamentally morally wrong to do that.
Yeah, I mean, it is tough to get progress in such a short space of time, isn't it? But I think certainly the press coverage that was gained from that is definitely beneficial, no matter what.
Yeah, certainly, and I've certainly had some clinicians even get in touch and say that they were supportive of what I was saying and that they did have their own concerns. So yeah, I think there is genuine concern here, and I think it is important that we do raise awareness and we at least make clear that if this guidance is followed, it has to be only in the kind of really most extreme circumstances, and even then, we should be focusing far more efforts on making sure that the resources are in place so we don't actually need to take these measures. I think also what concerns me is that there's no criteria being set out for when you actually make these difficult decisions. And my concern is that some trusts will be already making these decisions before we're even at like the peak levels of demand, and that concerns me really.
Yeah, it's kind of a crazy sort of set of affairs, really, isn't it? Like there's this alarming sort of guideline, and yeah, it's really kind of sparse in its detail and nature. And I think there's a kind of topsy-turviness to it as well. When situations like this happen, you're meant to look after those most in need,
Yeah.
with extra care, not just throw them to one side. I don't know, certainly something to work through.
And I know it's mostly just been kind of my voice on the issue, but I know a lot of other people are concerned about it. I mean, how do you feel about it, Sarah?
I mean, when I saw your video clip, then when I saw the news item as well, I just thought, I was so glad that you'd said it, because I think you speak for so many of us. That these are, scary times, and it would be nice to get some, better guidance and reassurance, really. Because the thought of being admitted to hospital right now is not a great prospect. I mean,
No.
thinking I just need to do all I can to stay out, which is what I've tried to do. But it's not always that easy.
No.
Yeah, I know. I mean, it just puts extra pressure on things like mental health and everything else, and just general stuff, doesn't it?
Yeah.
Which is kind of related to one of the things we were going to talk about today, isn't it? Those logistics as to how you deal with, your everyday care. Yeah, I don't know, John. Do you want to kind of bring in the topic a little?
Yeah. So certainly. So what we've been discussing is the difficulties associated with having carers and having lots of people come into your home in this situation, and the kind of the risks that we feel, particularly now we know the stakes. If we were to be admitted to hospital, we might not be able to access treatment. It makes it even more imperative that we do absolutely everything we can to try and minimize risk. And I think the way you do that with PAs is difficult, and I think also you've got to consider the impact on the carers themselves, and particularly if you employ PAs like me and Sarah, then I think we've got extra considerations we need to make as to how to make that all work. So so Sarah, what's been your experience so far?
I was thinking back to things that we've been doing for quite a while now. The first thing I did, which really helped to sort of get things sorted in my head, was to draw up a list of everything that needed regular anti-backing. All the things that everyone was touching, because that was at the forefront of my mind to begin with. And even, but obviously they were gloved. They started wearing gloves for more things than usual. So I think it was sort of that was the start of it, and then I started getting more PPE. I was able to buy some. I did have a stock already, but and my CCG did in fact supply some for us this week, which I thought was pretty good, move in the right direction. But sort of hygiene, I got them all Ziploc bags, big giant ones, so that they could put their own glass and their own mug and all everything that they would use here, so it would keep it separate. Which is, I think I got some good tips from a webinar attended about employing PAs. So that was a good one.
Wait, Sarah, can I just
Yeah.
come in and say, like,
Sure.
you had to buy PPE? You know,
To start with,
that's
I mean,
something in itself there.
I've claimed I do have an allowance for gloves in my budget, so I did pay myself back. And there's a routine, there's a procedure for that within my budget. But I think I probably went into panic mode a bit, and I decided that I ought to get masks, and so I did have aprons already. But really, as the weeks have gone on, I've been thinking about more and more things that I could obtain to make me feel safer, but also make my PAs feel safer. I think that's important too, because they're all really, worried about bringing something to me, and also if I was to get something, I wouldn't want to be passing it on to them. So I think I feel quite a lot of responsibility as an employer, and obviously they're people that I care about as well.
But if we just hone in on that point in itself, do you think that your CCGs have been more supportive? Could you have got more stuff earlier on from them?
Well,
Maybe next time round?
I think I get the feeling they were having trouble sourcing PPE, although, I was able to get stuff from eBay, fairly easily. But I mean, they have, like I said, after this is week 3, I have received some. So I think, that's better than nothing. And also they sent
Well, it's
guidance.
week 3 of lockdown. It's not week 3 of the virus.
No,
Yeah.
that's true. So they also sent some guidance, some written guidance on good routines, which made me feel better because I was pretty much doing everything they said already. But it was just that down on paper thing again. It's that making you feel a bit safer and less worried. And also, I made sure that I did permission letters for my carers so that they'd both be my PAs, so that they'd be considered key workers if they were stopped. Because I know that some people, especially if they were coming to me in the evening, I did have local car police stops around here where they were just randomly stopping people and asking them where they were going. So I just wanted to make things go as smoothly as possible for them as well. So it's a lot to think about, and mentally I found it quite draining. Although at the beginning, like I said, it's getting easier. So yeah, we're more into the routine of it now.
Yeah, and I think for me, it just goes to show that the whole system and, CCGs included, but I think they're only one part of the system. They've been so woefully underprepared for this. I think in particular when it comes to care workers working in people's homes, I think, often when health and care is talked about, then you'll hear about the frontline NHS workers working in hospitals and maybe even the community visitors, like the community nurses. And you might hear about people in care homes and care agencies, but you so rarely actually hear about personal care assistants that work in people's homes, particularly those that are actually employed by the disabled people themselves with government funding. And there has been absolutely no preparedness for this. No one's even thought about, like, the idea that people might need PPE in their homes, and no one thought about how you would actually kind of manage this workforce. And I think as Peter said, it's not week 3 of the virus; it's week 3 of lockdown.
That's
So
very true.
in terms of at least getting policies in place, they should have done this back in January when they realised it was a possibility. But the virus might come over here. I just think, you know, they could have done so much better. I think in terms of the PPE situation, I think both myself and Sarah, because we're on NHS continuing healthcare, and have a personal health budget, part of that budget setting has included a budget for PPE, but I think a lot of people in, you know, in social care settings, um, they haven't had any budget or any funding for PPE. So, you know, they're put into the situation of either buy it yourself or as, you know, I think for most people, you know, there's a finance issue there. They can't afford to do it. Then, you know, they're just waiting on it being supplied by local authorities and CCGs. And they're only just now even starting to do it in some areas, but yeah, for me, my CCG hasn't even contacted me at all since the entire coronavirus situation started. So I've had to, you know, using my budget, source my PPE, and figure out what people should be doing. And it's only recently that we've actually had some guidance as to what PPE should be worn in people's homes. And now we're finding out that it should be things, you know, like masks and gloves and aprons. And yeah, you know, that advice has been rubbish so far.
It's very slow to come out, isn't it?
Exactly. And I think also it's not just about supplying the PPE, because we've heard from experts saying, you know, PPE in itself doesn't make you safer unless you know how to use it. You know, just basic things like training. You know, I've had to have I haven't personally been trained in how to use it, but you know, I've paid attention, and I've had to have conversations with BAs, for example, about the correct way to take off gloves and to put them on. And you know, I've had people doing kind of doing things like, you know, taking off their dirty gloves, putting them on the table, putting on new gloves, and just then picking up the dirty gloves in the ball of their hand and throwing them in the bin. Like, having to explain to people you've just contaminated your newly put on gloves. You know, we needed training. We still do. Need training for people on how to do that properly.
I watched a useful YouTube video. I don't know if you saw it. It was a nurse that was showing. Basically, she used colour paint to show, say, the germ, the invisible germ, and was sort of using the scenario of going into a supermarket with gloves on, and then her phone rings, so she takes her phone out and does whatever, you know, texts or takes the call, puts the phone back in, and it just shows you that even when she's taken the gloves off, you know, she will come into contact with the virus again. It was the most effective thing I've seen so far, which I really want to share.
I think that can be the downside of all the PPE stuff. It's like you see people walking around wearing gloves, and I think it gives this feeling that, oh, well, I'm wearing gloves, so I'm safe. You know, it's like, actually, no, it's, you know, there's very little difference unless it's done in a very, very careful manner.
You know, we need to take the lead from like kind of radiation training and that kind of thing. You know, my husband has been trained in how to handle radioactive materials in his job, and that training is really intense and kind of, you know, really goes through it because lives are at risk. But you know, lives are at risk now, so we really need to be doing a lot better in this, I think.
Yeah. So as for that side of things, you know, that's the kind of the PPE stuff. As for the logistics and how you've managed, you know, your personal carers and everything, the logistics of that, how's that been? How's that been for you, Sarah?
Yeah, I've tried to minimise the number of PAs that come in my house. It was based on who was at the highest risk of coming into contact, um, what their partners did for a living, or if they had another job, because some people that work for me part-time do have more than one job as well. So I found I've had to make decisions, whether they're the right ones or not, I've yet to find out in terms of what the guidance is from the CCG or from the, in terms of employment law. There's a lot of grey areas. So I'm waiting to get some advice on that. But yeah, we're just trying to do the best we can, really, to get through the 12 weeks and whatever's after that. But yeah, my PAs have been brilliant and they're really careful as to what they're doing outside of work as well, which I'm very grateful for. But it's not always possible, I realise. So yeah, I would appreciate a little bit more guidance from the CCG on that sort of thing, on the employment situation.
Guidance and support as well, isn't it?
Yeah,
Because it's
yeah.
there doesn't seem to be any specific, like, well, this is what we'd advise, and then the sort of guidance that there is, there's not really any support if
Yeah,
you're then putting people in sort of precarious situations. You know what I
but
mean?
it's conflicting as well. And the insurance company saying something different. And also, we're getting one message from the NHS to do all you can to shield yourself. But then, on the other hand, they're putting barriers in the way as to what I can do in terms of my PAs. So, yeah, it's not great, but
Yeah,
hopefully.
I think that's one of the worst things is just the conflicting advice. Depending on the sources that you look at, and I think even the guidance around self-isolation raises some big questions. I think isn't always clear to people, and I'm not medically trained, so I don't know the correct answer. But then you look on the World Health Organization website, and it says there's an incubation period of up to 14 days. And perhaps that's the rationale for the 14 days of self-isolation if a family member or someone you live with um, comes down with the virus. But I've got questions from my point of view, like that's all very well if you kind of catch that virus on the day that your family member gets it, but what if you catch it when it's like a week into their symptoms? Surely then you need to give it another 14 days on top of that. So, it raises big questions. I don't know what the answers are, but all I know is that it's very uncertain and it's very kind of scary as an individual, seeing all this conflicting information and not knowing what exactly what you're meant to believe, really.
Yeah, it's certainly a crazy one, and I keep thinking, next time around will hopefully there'll be much better guidance and stuff, but it doesn't really excuse, the fact that right now everything's kind of up in the air.
Absolutely, and I do think there's more that can be done. I think we're being put in possible situations as our carers, particularly the ones that we're employing. Like the statutory sick pay is not much, and you can only get it in accordance with these 7-day and 14-day guidelines that the government have been given. But you might feel actually the risk goes higher than that. And yeah, if you kind of put people on reduced hours, then that limits what other support they can claim. I'm very mindful of people being able to, have enough money to live on. And I think where that's like not really good enough, there's not enough support for personal assistance, then it means there's an incentive, a disincentive for them to report their symptoms. They might have a kind of
Oh yeah.
sore throat or something, and they might say, "Oh, it's probably nothing," and I don't want to lose money by not being able to come to work, and there's no other real option for me, so I'm just going to kind of assume it's nothing. You know, you could end up being put at great risk because people are just concerned for their livelihoods and actually being able to pay the bills.
Yeah, yeah, absolutely. That's a really tricky one. We've been looking to end these ones on a positive note. So, Sarah, it's your duty now to tell us, in this crazy lockdown, what have you been doing to, despite all of this madness that we've just discussed, what have you been doing to kind of try and stay sane, stay positive?
Well, I would have been lost without things like Skype and Zoom. I've been arranging quizzes for my family and friends,
Wow.
and I do like a quiz. And I've also got a regular team, and it's like a regular charity quiz, and they've adapted it so that we can still do it and raise money for charities. So that's a really, good thing. And daily crosswords, and even a Spanish lesson on Facebook Messenger. So yeah, I'm trying to do things to keep my mind stimulated. Lots of catching up with friends who are in similar situations. Can't seem to concentrate on the TV very much. So yeah, just
Might be for the best, given all the
I think I'm
Yeah.
better staying away from it, to be honest. Yeah, and I'm lucky that I've got a garden, so I can go now the weather's better. I can get some fresh air and sit under my awning. So yeah.
Yeah, just kind of the same as always, really. Just trying to plod on with things, and get things done as best as we can. And like I say, with situation with my brother Andrew at the moment, it's kind of like still doing his care, but trying to kind of keep a distance in any way that we can when it's not absolutely necessary, and obviously PPE when it is. But yeah, John, have you got anything coming up?
So DMD Pathfinders did an Easter party last night, which was really good actually. We got quite a few people coming online, and we did a quiz and some online games. There are a few things that we were trying that didn't work out quite so well, but I think next time we do it, we'll start figuring out what works and what doesn't. But I think it was just really good to bring people together. You know, we had good conversation, good chat, and it was just really nice to be able to socialize. And I think we do plan to do more of those events. But I think it was just a really nice thing to do. And also, obviously, with the weather getting nicer, that always makes things feel a little bit better. So unfortunately, I live in a flat. I don't really have any gardens to speak of, but I do have patio doors that open out onto like a communal kind of grass area. But yeah, I just kind of be sitting in the doorway enough to get some sunshine. And yeah, that's felt nice, quite nice. That's always a bit of a boost to your mental health, I think.
Yeah. Well, thank you guys for watching, and thanks for sharing as well. Thanks for sharing your experiences, Sarah. And yeah, hopefully have you back on soon, and hopefully things will, we'll get a bit of normality sometime soon, and get through all this madness. And like I say, well, if we manage to get through it all right, every challenge makes us stronger in some way. Well, hopefully.
Yes, indeed.
I'm looking on the bright side, guys.
You have to.
Yeah, you got to.
That's it. Right, guys. I'll catch you in a bit. Thanks so much.
Thanks, everyone.
Bye bye.
Thank you.
Bye.
Bye.